Okay, so with that, we will go to the next topic, which is going to be, where do we stand now with this new variant, and what is the natural life cycle of viruses, and is there any light at the end of tunnel? Dr. Hamilton, please.
Thank you. Appreciate everybody showing up this afternoon on such a beautiful day. So I'm hoping here to provide you all with the fact that there is a light at the end of the tunnel for us. And hopefully it's not a train. So, as you all know, we're in the midst of this Omicron variant. The Omicron variant was identified in South Africa just not even 2 months ago. November 24th, I think, is when the World Health Organization named it. Started spreading rapidly through South Africa, rapidly into Europe, and interestingly, for the most part, seems to have burned out in those areas, if you will. In other words, case rates have gone down. What we've seen is decreased fatality with it compared to the other variants. And so overall, that seems to be a good thing. One can postulate that Omicron is, God's vaccine, if you will. It's going around giving people natural immunity. Now, it's a very different variant than what we saw when the first wave of Alpha was identified. The Omicron variant has somewhere between 30 and 36 mutations to its genetic sequence, and most of them are on the spike protein. You've all probably heard about the spike protein, and it turns out that in COVID, the spike protein is the thing that is one of the major pathogenic agents. When you get the spike protein in your body, it binds to the angiotensin-converting enzyme receptors in your lungs, and that's why people with severe COVID die oftentimes. They get very severe respiratory disease with this accompanying cytokine storm, as my colleagues discussed. Well, the good thing is it seems like those mutations to the spike protein make Omicron less likely to bind to the angiotensin receptors in the lung. It tends to stay in the upper respiratory tract, which is a good thing. That's what we know of as a URI. You've probably been to a doctor and they say, oh, you've got a viral URI. Well, URI stands for upper respiratory infection, and a lot of people call that a cold. Now, I say that not to minimize the fact that Omicron still has potential, still holds a lot of danger for people. And particularly, as my colleagues have mentioned, there is a population of people, there are individuals who have brittle diseases, diabetes, congestive heart failure, COPD, being in a particular age group or having other pulmonary problems and things, are still at very high risk, even though Omicron is relatively less severe on an individual basis. The other thing that makes it dangerous right now is it's everywhere. It is spreading, it has spread, as you'll see, very rapidly, and so it's just the sheer numbers. When you have that many people getting sick, it's gonna hit a lot of people. Next slide, please. So I pulled some data, and this is, we've been talking about this talk for a couple weeks now, and literally every day stuff changes. There's new data coming out nearly daily. But this is this came from the CDC website. They are the best we have at the moment in terms of tracking it in the US. And no more comments on that. But the good news is so the CDC has been tracking 7-day moving average of reported cases of COVID. Now, this is a tough one, right? Because how many cases are there really out there, right? I mean, how many people went to Walgreens, bought a test kit, tested positive, and called the CDC and said, hey, I got a case? Any of you? I wouldn't even know the right number or the website. So, and how many of you know somebody who tested positive and were sick and didn't test? So it's very likely that this is underreported in terms of the number of true cases out there. I mean, we know that to be a fact. But the good news is it does appear, and we'll hope that it continues, that the Omicron wave may have peaked in the United States. You can see it's headed down, and it would have peaked last Wednesday. Now, that's a 7-day moving average, so looking back 7 days, they say, well, this was the last 7 days, and then, Thursday they look back 7 days, but it was 890,000 cases reported to the CDC. Now, I'm assuming that's from labs where you go down, like Lab 24 here, or Quest, or one of those places that actually publicly reports their data to public health departments, who roll it up to state health departments, who roll it up to the CDC. So the good news is it looks like we might be headed down with Omicron. Let me have the next slide, please. If we look at hospitalization data, and again, this is right off the CDC website, and this is as current as it gets. What's interesting to me, and I'm going to actually have you go to the next slide, please, is comparing these graphs side by side. So if you look in the early phase of the pandemic, in the alpha phase there, January of 21, or actually in January of 21, and then the delta phase, and look at the relative number of Omicron cases. So these are cases on the left, thank you, Dr. Orloff, and these are hospitalizations on the right. So look how much higher relatively the hospitalizations were early in the pandemic to the height of the spike of the cases. In other words, the spike of Omicron is, what, 5 or 6 times as high as the alpha wave, and yet the hospitalization peak is maybe 1.5 times as high. The other thing that we're starting to understand better is that the CDC has not yet aggregated all their data, and they admitted this a couple weeks ago, and it makes it hard to understand things, but of people who are hospitalized with COVID versus people who are hospitalized because of COVID. And the same is true with deaths. So I think all of us in medicine have anecdotes where patients went to the hospital and were told, you've got COVID, we're putting you in the isolation, and yet they were there for something else. Now, it doesn't necessarily decrease the burden on the healthcare system, because we still need to protect, healthcare workers from those patients. This is moving on me here. We still need to try to contain the disease to the best of our ability. But the good news is that overall, Omicron looks to be far, far less severe than prior waves. And so I think that really should give us all some hope. Now, if you were a virus and you were trying to decide which direction to evolve, and your goal was to infect as many people as possible, your goal would not be to kill your host. It would be to go out there and infect people and then jump to the next people. And that seems to be historically what's happened. So next slide, please. Actually, this is one last slide. This is regional data on Omicron. And this is just from December 1st. And as you can see, the blue is the Northeast. So Omicron wave appears to have peaked in the Northeast of the country. So New York, Connecticut, New Hampshire, all those places. The blue is going down. It's sort of moving westward across the country. We here in California are probably considered the West, I'm guessing. We're pretty far west. And it's coming down in the West too. So the good news is it looks like we've probably seen a peak of Omicron, and doesn't mean we don't need to watch out and be careful and all that, but it looks like it's headed down as it has in other countries. Other countries have responded by backing off on some of the mandates and restrictions, and we're hopeful that that could happen here at some point. Next slide, please. So the other question that I started looking at was, how do pandemics end? Like, is it when somebody stands up and says, it's over, have a party? One of the challenges, I think, of this particular event in our lives is nobody's really given us what the end game looks like. I think there's been an unstated goal that it's somehow going to be 0 cases. And I think the day it got out of Wuhan, that goal was not likely to be possible. So looking at historically when pandemics end is a little difficult, because we have good records, and once again, history, there's a lot of information here to process. But typically what happens in historic times is pandemics rage for a period of time, and it's anywhere from 2 to 50 years, if you look back to the time of the Black Plague, which was interestingly bacterial and not viral. And eventually there develops sort of what we've talked about as that holy grail, that herd immunity, meaning the vast majority of the population has some level of immunity, whether that's natural or vaccinated, we can talk about. And eventually these diseases become endemic. So next slide, please. We've only actually been successful, and obviously we've only been as technologically advanced as we are for a few hundred years now, but we've only really truly supposedly eradicated one disease, which is smallpox. And that, it turned out, was not easy, but as Dr. Mu discussed, it was a very safe vaccine. It was a very high case fatality rate, so people who got it died. A lot of them died, so it was easy to not have to worry about it spreading quickly. And we've pretty much found that there are no other diseases we've ever been able to eradicate, and particularly things like coronavirus, which has an animal reservoir. I don't expect we'll ever eradicate coronavirus off the planet. In fact, a couple years ago, you got a cold, and there was a reasonable chance it was coronavirus. There's a number of viruses that circulate and cause the so-called common cold, amongst them coronavirus, rhinovirus, RSV, parainfluenza, adenovirus. I mean, and that's why doctors just tell you it's viral, because we mostly didn't have the testing to know, and honestly, it mostly didn't matter. Next slide, please. So there have been several pandemics in the 20th century. Probably the one that is most parallel to the coronavirus one was the great 1918 flu pandemic, and that killed 50 million people. That was a huge, coronavirus is not looking anywhere nearly as bad. So we've made some major strides. Whether or not you like what we've done or what we do, we've made some major strides. But ultimately, it ended. It took about 2 years to burn out. It apparently decimated the troops during World War I. And the sense is that it was a combination of the virus mutating and widespread exposure and natural immunity, eventually leading to it becoming endemic. And that's why we have a flu season every year, right? It keeps coming back. And by the way, why does flu get worse in the winter? Anybody know? Dr. Karenchis knows. Your vitamin D levels are low, and we're all inside together. So, combination of things. So, another plug for vitamin D there. The other interesting thing when you ask when does a pandemic end is because nobody really knows from a medical standpoint when that last case of coronavirus, that will be the last case of the pandemic, and now we call it endemic, is it's cultural. They've looked back, historians have looked back, and for example, the decision with there was a decision to sort of move on from the 1918 flu pandemic. And one of the things they say, for example, is there are lots and lots of memorials to all the lives lost in World War I, but almost no memorials to all the lives lost by the influenza pandemic. And it was almost like a societal decision to say, we're done, we're moving on, we're moving past this. So I think in a couple of years, we may look back and realize that, it ended, it just kind of died out, and it was partially a social and cultural decision to move forward. And I think, honestly, a lot of people have kind of made that decision in their heads. That's a tough one because obviously there's still danger, but I think we all have to think for ourselves. And finally, last slide, I think. So there is a light at the end of the tunnel. I think that's the message here. Widespread infection is relatively less virulent with Omicron. We have vaccines, and as we've learned, there are risks and benefits, and like any medical treatment, they should be applied individually in consultation with your healthcare provider, your physician, because people have different risks, and that's just kind of a lesson that I think we're all learning. Public health and lifestyle interventions and early treatments are shown to be effective. One of the things we're learning in this pandemic is that some old drugs that are being repurposed, hydroxychloroquine, ivermectin, fluvoxamine, Pepcid, and steroids, for example, inhaled budesonide, things like that, have some effect, and also obviously some supplements, some of that functional medicine stuff that turns out to be very, very important to our health. We do have some excellent pharmaceutical treatments now. Whatever you may think of big pharma, they've brought us some amazing treatments and some miraculous things. We have monoclonal antibody treatments. Some are better at Omicron than others. We have 2 new medications approved by the FDA that are oral medications that look very promising. I think they're very hard to get and very expensive right now. So I think the lesson from this is, early in the pandemic, doctors were told or were saying, hey, go home until you're really sick and then come to the hospital. Now we're learning that there are things you can do early, so do them. Take great care of yourself. Do your best to maintain your health. Jump on board with some of these early treatments, and I think there is a light at the end of the tunnel. My hope is that we end 2022 very differently than we started it. So thank you, everybody.
Thank you, Rob. Thank you, Dr. Hamilton. What a great conversation. So just to summarize, coronavirus is real. It's affecting all of us. It has affected all of us. But we can't get rid of it completely, most likely. And we should not make the treatment of the disease worse than the disease itself. So let's not shoot ourselves in the foot, right? That's what we're saying. And part of that is fear. So we don't have to be fearful of it. We don't have to isolate ourselves and be fearful and not treat early and not get out of the home. We can find a balance as we have done as a human society for thousands of years. So we have much better tools than we had 100 years ago. We don't have to fear it. Fear is our enemy, right? Is that the message which everybody feels? So with that, unless you have any comments, any one of you, I would like to conclude this session and we can go on to a short break.